Hello, everybody. Thank you very much. All right, tonight's program is sponsored by Genentech, Novartis, Sanofi, and TG Therapeutics. Tracy is an occupational therapist. I've known her for an extremely long time. I know she's going to give you some great information. I hope you can write it down and be able to share it, with your families, friends, or whoever else that need to possibly assist you. And let's just get this thing going. Okay? Thank you.
So yeah, thanks so much for having me. Thanks for everybody who came out and anybody that's online watching this. So like Stuart said, I am Tracy, and I married John Tracy 25 years ago. So Tracy. And I'm an occupational therapist, and I'm happy to say I finished my PhD on March 7th. So I'm no longer a candidate. Yay! And it was really thanks to a lot of you guys in this room that were part of our teams, our tele-exercise and MS study. So appreciate you guys. We have reported on that information now. So I'm here to talk about, is it age-related or is it MS? And I work for the Tanner Foundation with Dr. Emily. I've been there since 2011. Okay, so we're going to talk a little bit about aging tonight, and here's just some statistics to let you know that if you are like me and you're getting into your 50s and 60s, you are no longer going to be in the minority. We're going to be the majority. So in 2020, people 60 years and older outnumbered children 5 years and younger, and also the number of the world's population 6 years and older will double between 2015 and 2050. And then by 2060, there will be 88.8 million of us. So we are definitely taking over the planet. And I don't know if anybody recognized that phone on the wall, but we no longer have that. But if you did, then you're probably around my age. So with aging comes some chronic diseases. So 95% of older adults have at least one chronic condition. And really 80% of older adults really have more than one, especially here in the Deep South, right, where we see that happening a lot. And that really costs our healthcare system about $1 trillion per year. So the leading cause of death, as you can see here, is not COVID-18. Sorry, I gave a new virus. That's a typo, COVID-19. Chronic conditions, we see cardiovascular disease. So some of these I'll just kind of explain briefly. So one of those is hypertension, which is high blood pressure. And about 70% of people 60 years and older have this. So men are more likely than women until we start to hit that menopause age. And then we become likely to have this too as well. So there's some things that you can control, such as lifestyle, and also looking at your medications to see if maybe that might be contributing to it. But there's also other things we just can't control, like genetics and vascular changes. There's also heart failure that we see as we age. So 5.7 million people, adults in the U.S., have this condition, and 1% over the age of 50 have heart failure. But as we age and get older, that percentage increases to 10% at 80 years of age. So heart attack is something we also see as we age. So men have an increased risk of this at 45 years and older. But of course, us, as women, when we get closer to menopause, we have an increased risk as well. So risk factors are family history, lifestyle, and then having other comorbidities like hypertension. And really, we just see the causes are really just changes over time that are associated with aging. And then we have a high risk of stroke as we age as well. So your risk doubles every 10 years after the age of 55. And age is really the most common risk factor. It's non-modifiable. You can't do anything about it. It's just your percentages, your chances increase as we age. And every 40 seconds, someone in the United States has a stroke. So when we think about aging too, there are some musculoskeletal changes that we see. So osteoporosis, which is that reduced bone density, happens and occurs. It's more likely in women than men, and particularly in white Asian women. Women that are thin-boned or that have family history, those are really your risk factors. Some of the causes, as you can see here, is low estrogen, low calcium, but also low vitamin D, which we know is associated with multiple sclerosis as well. So it's something you probably want to stay on top of it, particularly when you start to age. And it impacts about 54 million people in the United States. So then arthritis, which is really just a loss of that cartilage. Causes can be wear and tear over time or overuse, but really as we age, we become more likely to see this. Some risk factors are older joint injuries. So if you've ever broken your ankle, then sometimes arthritis will set in then. Obesity, so something to think about. Genetics, and then women are more likely than men, which we're hearing a lot of that a little bit as we age. And then it impacts about 53 million people in the United States. So pretty similar to what we see in osteoporosis. So diabetes is something that also the chances of us becoming diabetic increase as we age for type 2 diabetes. So about 16.5 million seniors are diagnosed with type 2 diabetes. Some of the risk factors are really the decrease in the muscle mass, decrease in physical activity as we age. So that just kind of tells us we need to exercise, we need to strengthen, right, to kind of stave off this risk. Also, other comorbidities and sometimes some medications can cause diabetes. So you want to make sure that you're not on something that could possibly increase that risk as you age. Okay, so we can't talk about aging without talking about falls, right? So falls are the leading cause of fatal and non-fatal injury to older adults as we age. 1 million adults over the age of 65 fall at least one time per year. And then 3 million people 65 years and older go to the ER with a fall injury each year. And this costs the healthcare system about $50 billion per year. So pretty significant. So falls, they are associated with cardiovascular disease. So some of the causes might be orthostatic hypotension, which is really that drop in blood pressure as soon as you stand. And there are some things that you can do to kind of stave that off. So if that's something you feel like is happening. Frailty, syncope, which is just that dizziness, not sure what happened, you end up on the ground kind of event. So the risk of falls when you have cardiovascular disease increase as you age by about 40 to 60%. So pretty significant. Heart murmur, angina, heart failure, these kind of conditions, cardiovascular conditions, were associated with more recurrent falls. So not just that one we see a year. Those are the people that we really need to get into a fall risk management plan in order to kind of help that. And most of our data based on falls comes from secondary analysis. And what that means is we're not really even studying just cardiovascular disease and what that fall rate looks like in the aging population, which is maybe something we need to kind of narrow down on because we know it costs us a lot of money and a lot of injury. So falls as they associated with osteoporosis and arthritis. So we see about 30% of people with osteoporosis and about the same with arthritis have falls. And the most common fracture sites that we see from a fall with osteoporosis is the spine, the wrist, and the hip. So it's really increased risk due to kyphosis, which is like the curvature of the spine, and really weakness. So there is some ways that we can modify our fall risk when we have osteoporosis and work on our postural control and strengthen in our core. And then fear of falls is strongly associated in this population with actually their fall risk. And then for arthritis, the more joints that you have in your body that are impacted by arthritis, the more your percent goes up to actually have a fall. Rheumatoid arthritis was the one that had the highest risk of falls out of all the arthritis. But then when you're symptomatic, when you have osteoarthritis, so you have a joint that's inflamed or bothering you, your fall risk does increase. So kind of tells you that maybe you need to actually treat, not just not pay attention to it. Maybe try to do something and that will then decrease that fall risk. Okay. So falls are there associated with aging and diabetes. So the risk of falling when you have type 2 diabetes is about 59%, which is significantly higher than people who don't have type 2 diabetes. And probably some of the reasons is because we have what's called peripheral neuropathy that's associated with diabetes, which it can also be a common symptom of MS, which is that tingling, numbness, pain, just strange sensation in the lower parts of your legs. Then also you see vision changes when you have diabetes, which also can cause a fall, which we know happens with MS too as well. And medication can also be, the medication side effects can also cause falls when you have diabetes as well. So physical activity, we love to talk about that. I love to talk about that because I think it's so important for all of us, not only as we age, but in particular, if you have other conditions that you're dealing with, then it's so important to stay active. So unfortunately, in 2019, only about 23% of the aging adults actually met physical activity requirements. So what are the physical activity requirements? So the CDC really recommends about 150 minutes of moderate intensity exercise or 75 minutes of vigorous kind of aerobic capacity. So they want you to really put in strengthening and aerobic exercise, but as you age, they actually add that you really need to have a balance intervention. So we like to tell our patients, it doesn't have to be something where you're setting aside like a great amount of time to work on balance, but if you're just doing some things every, say 30 minutes or every hour, you can do things like when you're washing the dishes, just try to, just maybe put balance on one foot or even hold your foot up. Just kind of adding some of that balance around your house when you're doing kind of different activities, kind of challenge yourself instead of having to put aside a big bucket of time just to work solely on balance. So when we're thinking about some strengthening options, there's two different strengthening that you can perform. There's an isotonic type of strengthening, and then there's an isometric type of strengthening. I particularly like to work more on isometric exercises with my clients that are aging and particularly that have multiple sclerosis. So I think a lot of these exercises that you see here really work on what we call proprioception. So it works on really where your body is in space, which can help when you are actually don't have a lot of, you have some numbness, tingling, some sensory problems. So things like planks, bridges, wall squats, V6, and then ball exercises. And I mean, as in squeezing and holding the ball or pushing down on the ball. That kind of strengthening component really helps. All of these can be modified to do them sitting or doing them with support or doing them in the bed or doing them in a chair. So as far as how to do these different things, there's some video content online that I'm happy to share with you guys as well, but also going to see your occupational or physical therapist and just getting them to set you up on a modified exercise program to do some of these would be beneficial. So when you're doing isotonic strengthening, they suggest that you build up. So you start with a lightweight, low repetitions, and then you want to increase that over time. When you're doing isometric exercises, then you want to start by holding either, like I was talking about ball squeeze, hold for 3 seconds, and then trying to build up the amount of time that you're holding that exercise. So that's kind of the thought and the differential ways of strengthening your muscles as you age. So also, dual tasking is so important to incorporate as we start to age, particularly when you have multiple sclerosis and you have different things going on within your body. So what is dual tasking? We all multitask all day. So there's 2 different ways you can think of dual tasking. One way is a motor activity. So this would be something like a vision activity, such as just glancing side to side, actually following objects with your eyes while you're doing something else. So vision would be the motor component of it, And then the second piece you'd want to add to make it a dual tasking would be to do some sort of balancing exercises. So maybe you're standing with your feet together while you're doing your vision exercises. So now you've got a motor and a motor component. Another idea for adding or doing a dual tasking motor component is to add a fine or gross motor activity to whatever you're doing. So for example, a fine motor activity could be if you have a scarf and you want to simply tie a bunch of knots in that scarf as you do another activity. So it could be, say you're sitting on a Pilates disc. So you're balancing yourself on that disc while you're doing a fine motor task. I mean, it could be flipping over coins or stringing together paper clips. So anything where you're using the motor of trying to balance or do something else while you're doing that fine motor task. A gross motor activity that you could do is try tossing a ball up and down while you're either sitting on something like an unstable surface, even the edge of your bed might be challenging enough. Or do it while you're standing. If you're feeling comfortable, like you're not sure about your balance, a great place to do balance exercises is in the corner. So that way you have the two sides to balance you. And if you want a chair in front of you or you want your walker in front of you, then that should secure you in for sure. So another way to perform dual task training is a motor and cognitive component. I think this is very important as we age. So the cognitive component could be, you could be counting by twos. You could be subtracting by threes. You could think of animals that begin with each letter of the alphabet. I think that was a game I used to play with my kids on road trips. You can try to do the alphabet backwards. You could just complete a storytelling. So just, think of how you met your spouse or what your child's first birthday was like, but something that could keep you talking that you're having to actually think about while you're doing another activity. Be that a balance activity, or maybe it's just when you're washing dishes and you're trying these cognitive components. You're folding clothes, trying these cognitive components. So that gives you a motor and a cognitive task. Another thing is sequencing. So you can just say, okay, I'm going to say out loud exactly what I do in the morning to get ready. So just some thoughts on how to add dual task training as you age. Complementary alternative medicine is, these practices have been around for a long time. And I think that's why they're so effective. I think a lot of people who have adopted these practices, I think there was some things highlighted, and I don't know if y'all know the blue zones, but there was some of these practices, particularly Tai Chi, that was highlighted in the blue zones. These are areas in the world where people live to be over 100 and actually thrive being over 100. But Tai Chi is something that I think there's a lot of really good videos out there right now on Tai Chi and adaptive Tai Chi. There might even be some classes in town. I know the Lakeshore Foundation has tried to do some Tai Chi classes. But these are some peer-reviewed benefits that I found when I did a literature review. So the benefits include body composition, so change in BMI, increase in bone mineral density. So if you think about osteoporosis, this would help with that. Cardiorespiratory fitness, so all those, aerobic activity, aerobic benefits. It actually decreases your cardiovascular risk factors. It helps with memory, and it's had a great impact on psychological health. So a lot of good things out there for Tai Chi. And they have a lot of adaptive programs in this area too as well. And then Pilates, the benefits that I found in literature were increased flexibility, improved walking ability, and an improvement in balance. So I like Pilates. I like Pilates mixed with yoga too. I think Pilates adds a lot of that isometric strengthening that we were talking about before, helps with that proprioception I was talking about, where your body is in space. And it has a pretty big focus on core strengthening, which I think is so very important to all of us as we age. These are some programs that I found that are all free for those for the aging population. So some of them are just strictly online programs, but some of them are actually programs that you can consume within your community. Like I know there's a lot of Walk with Ease programs across the United States. Some of them are self-managed, so you would self-pace yourself through these programs, but some of them are group activities too as well. So you could meet others and kind of learn from them what works for them too as well. So I'm going to shamelessly plug one program that I'm involved in. So this is a remote free program that's available to anyone across the United States. You do not have to be diagnosed with MS, so you could be a caregiver. Also, you just have to have identified as having a mobility limitation. So what does that mean? It could mean you have arthritis and you have some pain. It could mean that you have vertigo and sometimes you get dizzy. It can be anything as long as you self-identify as having a mobility limitation and you are 18 years and older and live in the United States. So NICPAD Connect, this is through the National Center on Health, Physical Activity, and Disability, and we're funded through the CDC. So in 2021, NICPAD's existed since 1999, but in 2021, the CDC wanted us to collect health data on people living with mobility limitations. And so we didn't want to just ask people for their data. We wanted to give them programs. So we developed a few health promotion programs that we're able to offer once you finish a longitudinal survey asking about your healthcare status. It's not research, it's just a program. So one of the flagship programs that we offer is Mentor. It stands for Mindfulness, Exercise, Nutrition to Optimize Resilience. So we've seen great benefits through this program for people living with MS, particularly with mindfulness and pain. There has been some support that we've seen through the pre and post data that has really helped with pain levels in people with multiple sclerosis. So that's an online program where you get a box of exercise equipment that you can participate for free. We also have a mental health program. It's called Growing Resilience Out of Wellness and Thoughtful Habits. We like a lot of acronyms, unfortunately. This is a mental health program that lasts for 6 weeks too as well. And then we have a weight management program called State of Slim Everyone, because as we saw in some of the slides, obesity is a modifiable factor that we can change to help us with arthritis, with cardiovascular disease, and diabetes as well. So Stay to Slim Everybody, you get a box of equipment to participate there as well. You get a scale, but you also get a wheelchair accessible scale if you need that, which is really nice. And this has evidence of 10.5% of body mass loss in the 16 weeks of the program. And then we have a really fun program called Coffee Club, which Sean can tell you all about. So we meet twice a month. We have wellness experts come on. So we had the guy from the Blue Zones come and talk to us that too, but we might do like neurodoodling. We might do a gardening class. We had someone come and talk about UTIs. So just different topics. We mail you coffee and snacks to participate. It's just a social program. And so this year, we're also going to be adding a diabetes prevention program, as well as a program called Movement to Music, which is really fun. It works on physical activity and cardiovascular, and it's just what it sounds like. You're doing exercise to music. And then we added a caregiver coffee club, Care Partners. I forget, we're changing the name. So what are some adapted devices that can help us as we age, specifically if you have multiple sclerosis? So I just learned, and maybe someone in the room knows more about this app, but I just learned about this Be Care MS app that was designed. It's actually free. and it's designed by someone who, a husband whose wife had multiple sclerosis. So I think some of the features, as I understand them, is that this helps you track your walking status. So it can see if you've had any changes in your walking status. It prompts you to as well to do some kind of testing, things like that, just to see if anything has changed. And there's other things I think that it monitors, maybe like medication management and that kind of thing, but it's a completely free app, which is great. We do have a lot of remote therapeutic monitoring tools that are coming out now. However, a lot of them are a cost, either to the patient or the healthcare system. So it's really nice that this one is free. So we should probably all try to support it so it stays around. Modus Nova Recovery at Home is another piece of machinery that's actually now it's covered by Medicare for people with multiple sclerosis. So it is an actual machine that you can use on your foot or your hand, and it does range of motion exercises for you. So it helps with strengthening the limb. It helps with, spasticity and tightness. It can actually help you to loosen that limb up. And the foot device has been shown to help with foot drop too as well. Dragon Home is a device that you can use if your fine motor skills just aren't working that day, or you're fatigued and you don't feel like doing any typing. Then you can actually use Dragon at Home to help dictate to type whatever you need to type. There are some robotic hands and arms. Canova is one in particular. So this is a device that you can actually hook to your chair that actually acts as an arm for you. And it's a smart device, and you can program it to do all sorts of things, even feed, or hold a drink, whatever you might need this to do. There's all kinds of voice-activated home systems. We're so lucky right now, right? We can do our Alexa, turn our lights on, Alexa, turn the music on, all kinds of things. So definitely take advantage of that, particularly if you're someone that's fatigue driven, or you're having, fine motor difficulties, or, it's good to utilize these things. And then there's a neural sleeve now that's come out, which is actually, I've seen it mainly for the calf that you wear on your leg, that acts kind of as like a muscle stimulation for different parts of your leg. So it actually is building that muscle while you wear it, but it can also help with walking too as well. So not the Bioness, not for the foot drop. It's more to activate parts of your lower leg. Yeah, I think that's all for me. I'm taking questions now.
People want to know if they have links for all those different devices you mentioned.
Oh, yeah, I can send them to you.
Okay, when you send them to me, we will put them up on the YouTube channel with your presentation so people could have them as well, okay?
Yeah, and I can add more descriptions to those free aging programs too as well. I had them in my notes on my PowerPoint, but I realize now I don't have those.
Yes, they're asking for the links on the adaptive devices, and they're asking for the links that you mentioned about your programs that you have, so that
wonderful.
we can get all that and put it out on there, okay?
Yeah.
All right. One of the questions that was asked, though, is another one's asked about NCHPAD, but I gave them that link directly. And then there were others asking the best time when people need to find a company that could help them change their home around for better use, like in the kitchen. Do you have a site that they can access?
So I don't have one site per se, but I did learn about this group called, it's either Help Hope Live or Hope Help Live. But it's kind of a neat company. They've been around for 40 years, but they actually help you raise money for any kind of medical necessity. And I actually was on a call with her recently, and she said home modifications does fall in this. So the company helps you kind of establish not just a GoFundMe, but like a whole fundraising kind of campaign. They manage it all for you. They are the ones that actually get the money. So they then manage that money side of it for you too, like taxes, all that kind of things, walks you through how you need to use it. And it's for a very small percentage of the money raised. And they're constantly helping you with this campaign and kind of continuing to engage you. And that was one thing, one of the people on the call with me, with her, was saying she needed some major home renovations for her loved one that had a spinal cord injury. And that was definitely something that she could do through that organization. I'll make sure I get the right name to you for that
Great.
one.
Great. Thank you. How do we know if deterioration and problems are due to normal aging or MS progression?
I think that's when you have to really, stay with your neurologist, your primary care practice. I don't think you should assume it's one or the other. I think keeping track, like through the app, like I said, so that you're noting when you have changes. And then I think Dr. Emily probably tell you, is it the change like over time? Like, is it slowly over time, or is it more like a relapse event that might be more MS associated? But I definitely think just making sure you're going to your doctor's visits, self-monitoring yourself too as well. And not always assuming like everything's MS, and not always assuming everything's aging too. So, and look at the risk factors that I kind of said today. Like, are you falling within that category? Are you a woman that's going through menopause right now, and suddenly you're having all these different changes and symptoms? That might tell you it's probably more of the aging process. But
Another person is asking if you have a website.
me personally, no. We have the tannerfoundation.org, and then we also have the nicpad.org too. So those are both the organizations that I work with.
Thank you. Another person is asking, where can they learn more about accessible vehicles?
Oh, we have some videos actually through NICPAD that we can share.
Can you give that link, please?
Yes, it'll be our NICPAD YouTube channel. There's a lot of videos on there about accessible cars, but yes, I'll give the link too.
No, can you say it right now?
Oh, www.nchpad.org.
Thank you.
And then
I've
there's
gotten so many people asking that same question over and over and over again.
Yeah, and I'm sorry I brought materials for the audience, but I'm happy to connect with anyone.
You talked about the cost of healthcare. Does that include what the patient is paying, or is this in excess to what the patient is paying?
It's just based on hospital data. So I'd say yes, it probably includes also what the patient's having to pay from the hospital perspective. But then when you go home, it's probably not collecting any of the repercussions from a fall. Say if you then go on to do home health or some sort of outpatient therapy, it's probably not capturing all of that.
Okay. Next one. So next one didn't hear what you said about the vehicles that need to be converted. If you can say something more about that.
So we have videos online through the NICPAD organization. Our YouTube channel has many videos on how to adapt your car. We also have a directory that if you wanted to get in contact with us, that we could find someone within your area that would be willing to do that too as well.
Okay. And the next question to do with the vehicles is the cost covered from somewhere, or do people have to pay for this all by themselves?
I think there might be some cost coverage through maybe a vocational rehabilitation program, but that would mean that you would most likely have to be employed. There might be some cost for a veteran that could be supported, and maybe United Way, but I'm not totally certain. Then again, if whoever wants to get in touch with me or with NICPAD, we have expert inclusion specialists that can hook you up to these different resources within your community.
Okay, thank you. Another person is asking if insurance covers any of the devices that you were speaking about earlier.
Yeah. So for sure, the Modus Nova device that I talked about, that was for hemiparesis, spasticity, or just weakness in your lower extremity of your hand. Medicare does cover that now for people living with MS. And I think it's a 3-month use. So you get the device for 3 months.
Do we really have definitive evidence that taking large doses of vitamin D to get values of normal helps osteoporosis or multiple sclerosis?
That might be a Dr. Emily question.
Okay, we'll save that
But
one.
I would say yes.
Can you give us more information about these accessible vehicles?
What sorts of information?
What is recommended? What kind of
It all just
vehicle? What
depends.
kind of lifts for it?
Yeah, I don't know if I'm the expert on that, unfortunately, but it just really depends on what you need, I think. There's ways to modify for one-handed driving. There are different lifts, as you said, different mechanisms. That would certainly be more of an ATP specialist or someone that would go through that assessment with you to recommend that. It's an assisted technology expert.
Gotcha. So we've seen a lot of the vehicles around, like in Florida, especially between the elderly and people with true disabilities. And the biggest problem that we see is that they have the different vehicles that have the side ramp or they have the rear entrance ramp. And the problem with the side ramp is in Florida, it's very, very difficult to find a handicap spot.
With that.
And
Much
if they do
space.
have handicap spots, they don't have it with the hash lines next to it. So you can't really get the ramp open
Yeah.
to use it anywhere.
Mhm.
But nobody tells you that when they're selling these vehicles,
Yeah.
And then if you have the one with the rear entrance, you lose your whole back seat.
Yeah.
So you can't even have somebody in the car with you.
Mhm.
All right. So that becomes a big issue as well. So now we need to find somebody to make it so that way you could do all the above and still enjoy your vehicle.
I wish that there's probably an engineer out there that would love that sort of project, but definitely
Yeah.
not me.
I'll get to it eventually.
I will say there is a new service through Uber. It's an Uber Health service. So there's different states that are trialing this and are doing a pretty good job with it. It's not here in Alabama yet. We are using it in one of our projects to help. We were hoping to help with rural communities, get people to appointments, but unfortunately, there's not enough Uber Health drivers. So what we're finding is if you live in a rural community, it could be a day that you need to go, but maybe you can't find an Uber Health driver. But I know there was a project done in Mississippi using Uber Health that worked pretty well. But I don't know what kind of accessibility features they have either.
I just wanted to know how the is it the Nova the
Modus Nova.
the
Uh-huh.
one that you said that do you have to get the recommendation from your doctor? Or
Yes.
you have
Yeah.
to be
It's based
approved?
on a physician referral too.
Okay, and you'll have that list of everything, the accessible things you said you'll send it out.
I will with the links.
Okay.
I'll send it to Stuart. She can get that. And one thing that's really cool about the Modus Nova device is if you think about the dual tasking I was talking about before, they have some gaming component, some visual components with it too, particularly with the hand device. So you are kind of getting that cognitive motor when you're using that device as well. And they're out of Atlanta. Modus Nova is out of Atlanta, so they're pretty close.
Do you have any experience with the Wii balance board?
Oh, yes.
What do
Yeah.
you think about that?
We used it for years, even in our clinic for a long time. I think it's great. I mean, I think all the Wii devices are really fun. They've actually, I mean, I'm losing it. The Oculus, the video gaming, that has been being used far more now, I think, to simulate those real world environments and really immerse you in those video gaming. I know they're doing a lot of studies on the virtual gaming and even like sometimes making it to where it can look like your house. Like they can simulate your kitchen and have you doing like therapy in your kitchen while you're with a therapist. So it's pretty cool. They're doing a lot of that with pediatric care too, I think. But I think a lot of people have probably moved more to that. There are some people still using the Wii board, I'm sure, but.
Great. Any other questions? Let's call it a wrap. Thank you very much.
Thank you.
Thank you. Everybody have a great night. Ta-ta.